I got an interesting one here. I think this is a pretty good segment because it's something that some people know about and some people don't. I always like to keep you guys on top of these things so you can impress your friends at the next dinner party you go to. So today we are going. Okay, let me ask you. Do you know there's 2 types of fat?
Yeah.
2 categories. Does that make sense?
Like to ingest?
No, like in our bodies.
Oh, I think so.
Okay, so you have some idea. Trey, 2 types of fat. You heard about this?
No, I'm not.
Okay, so there are definitely 2 types of fat. There is, and this is important in the realm of plastic surgery, which is why it kind of came to my mind because I'll explain a little bit about how this came about. But there is what's called visceral fat and subcutaneous fat. Mm-hmm. And they have very different characteristics and health implications. So I'm going to give you guys a crash course in these. So visceral fat would also be called internal fat. And this is fat that is deep in the abdominal cavity that surrounds our organs, all right? Mm-hmm. So it's below our abdominal wall, which is our 6-pack, well, or 8-pack if I'm talking about myself, but 6-pack for most people. So visceral fat, because viscera means organ, okay? That's like I don't know if it's Latin, but when I hear the word viscera, I automatically think organ. So visceral fat is fat around our organs. This fat is not visible. You can't see it, but it can be felt. And the most classic way that you might imagine visceral fat is the beer belly.
Yes.
When you feel, if a guy's got a very protuberant stomach and you feel it, it's often very hard versus the more soft fat that a woman might have. You can more feel this than see it. So what is its function? Well, it protects our organs. It actually does something. Mm-hmm. If you're in a car crash and you have visceral fat, you're less likely to get an organ injury because it serves as a buffer or a cushion for your organs, which may get jostled should you be subject to some trauma. It also, of course, stores energy. There are health risks, though, associated with visceral fat because visceral fat is definitely not as good for you as subcutaneous fat. People with visceral fat more likely to have type 2 diabetes, heart disease, hypertension, cholesterol. I mean, some of this is the fact that the more visceral fat you have, the more chance you would have of being overweight, which does carry those things. So let's see, I got a picture of, there's a diagram of the visceral fat versus subcutaneous. So the picture on the left the yellow obviously is the fat, the pink is representing different organs. And you see how these pictures are different. There's about the same amount of fat on them, but on the picture on the left, the fat's all kind of clustered around the organs versus the picture on the right, there's really not a lot of fat in there, and it's all on the outside, which would be subcutaneous fat, which we'll talk about in a second. It can be difficult to measure visceral fat and know how much someone has, unless I can kind of get an idea, because this is my whole career is evaluating people for things like liposuction and whatnot. So I've become very...
Because you liposuction subcutaneous.
Correct.
Fat, so.
Yep. You're kind of getting to what I'm going to be talking about. But you can measure this with a CT scan. I actually got 2 different CT images. Trey, can you put up that next image for me? Right. So the picture on the left shows visceral fat. So in that image, the dark kind of big black void that I put the X's on is visceral fat. And you'll notice that there is a lot of it in that picture, but it's very different from the picture on the right, where that patient has a lot less visceral fat and more subcutaneous fat. You can see the skin layer there is much further away from the structural part of the body, whether that be rib or muscle, whatever that is, depending on what level that's at. You can see that those pictures are very different, and that the visceral fat is more internal. The thing about visceral fat is it is more influenced by diet, stress, and hormonal factors than subcutaneous fat. And interestingly enough, this was kind of news to me, if you have high stress or poor sleep, you're more likely to accumulate visceral fat.
Yeah, I think we talked about this whenever we were talking about...
Wait, have I done this segment before?
No, I think I did when I was talking about cortisol.
Oh, cortisol, right.
Whenever you're in the fight or flight response,
right.
you have a lot of cortisol, and then your body retains more fat.
True.
Because it thinks it's in danger.
Yeah, that makes sense. So visceral fat is in opposition to subcutaneous fat. So the way to think of subcutaneous, the easiest way to think about these is internal, external. Mm-hmm. So subcutaneous fat is external. It's just underneath your skin level. This is most likely found in the belly, hips, thighs, butt, breast, and arms. It's the soft, pinchable fat that contributes to the shape of our bodies, versus visceral fat generally doesn't. It also gives women their curves, or men their curves, depending. Its function is for insulation and energy storage. Also, it does provide cushion for skin and muscles. And interestingly enough, I remember, I'll never forget this case. I remember a patient that, when I was a general trauma surgeon, that got shot, and they were, a little heavier person, and the bullet actually was slowed down enough by the fat that it couldn't penetrate the muscle layer of the abdominal wall, which was wild. Bullets obviously are very, very dangerous and very fast.
It's wild.
And the fat slowed it down enough that it potentially saved their life. The other thing that's beneficial from the function standpoint of subcutaneous fat is it produces leptin, which is a hormone that regulates both hunger and metabolism. Health risks for subcutaneous fat is generally less harmful than visceral fat, but if it gets in too much excess, it can contribute to obesity. Subcutaneous fat is more influenced by genetics, calorie balance, and exercise, and it's thought to be much easier to lose than visceral fat. So if you have two people and one has more subcutaneous fat buildup versus someone that has more visceral, the person with the external subcutaneous fat is going to be able to lose that easier. Visceral fat losing is more about your type of diet, the type of foods you eat. You want to eat less processed foods, sugars, and carbs, and also reduce stress, which is one of the reasons you get visceral fat. Versus subcutaneous fat is purely about calorie intake and expenditure and physical activity, so it's less specific. But the biggest thing, and how I kind of got onto this topic, is I'm not sure if you guys know this, but there is a very distinct difference in what type of fat that you have based on if you're a man or a woman. Men are much, much more likely to have visceral fat.
Yeah.
And that's due to the fact that men have less estrogen and more testosterone, which testosterone causes more buildup of visceral fat.
Okay.
Versus estrogen, which is more in women, causes buildup of subcutaneous fat.
That makes sense.
It does. But there is some crossover, and getting back to the reason that I was doing this segment is I just very recently did a pretty significant liposuction on a man, and that's interesting. Why? Well, because most men have visceral fat. I've had several men come to my office with very big bellies, and they're asking for liposuction, and when I feel them, their subcutaneous fat layer might be like this, which is not big at all, but they have this really big belly. Well, how is their belly big? Because they're just all visceral fat.
Yeah.
And occasionally, though, you'll see crossover. I've had, like the patient I did recently, that's a man that had a pretty significant amount of subcutaneous fat. I ended up pulling around 4,000 cc's of fat off him, which is a lot.
I wonder if he has a hormone problem then.
So that's a very, very good question. Either his genetics predispose him to have more subcutaneous fat, or he does have some sort of shift in his hormones. It's kind of like when we talk about gynecomastia, where men get the more feminine chest where it looks like breasts. That's oftentimes also a hormone issue.
Yeah.
So it makes a big difference, because in my business, I get a lot of people wanting liposuction, and sometimes on the other side of that coin, I'll get women that come in and want liposuction, and they have visceral fat, and also things like tummy tucks, where you're trying to tighten. If there's a lot of visceral fat, it'll resist that tightening because there's so much pressure on the inside. So I think it's important to know the differentiation between these two. Because one, not that everyone's running out and getting plastic surgery, but whether you have subcutaneous fat or visceral fat does change what your options are, both not just for plastic surgery, but more commonly for how easy it would be to lose that fat, and also how you specifically might go about that. And so, I think it is kind of a interesting topic. I don't think a lot of people necessarily know that there's a difference in those two things, but it is absolutely different, and also too, from just a pure health standpoint, if you have a lot of visceral fat, you are more prone to have medical conditions from that, versus somebody who has an equal amount of fat, which is subcutaneous. So
good to know.
Yeah, I think it is good to know. So